Um, Sorry, I have just landed in Japan, so I'm not prepared to present this speech, but I would try to do it. Let me take this opportunity to unlock the secrecy of personalized and precision medicine through the view of reproductive healthcare and natural family planning as an option for clinicians and caregivers realize the potential of genomics-informed care to secure the individualized human biosafety. So, you might see that canonical healthcare is becoming increasingly unaffordable, yet it remains ineffective in preventing or effectively treating chronic diseases and thus to secure the health and the reproductive resources of the mankind. At the same time, a growing family needs a doctor who knows, along with the relatives, their children and cares for the kids like the own ones and keeping them healthy. Several congenital pediatric disorders are known to arise through multifactorial inheritance, such as cleft lip palate association, clubfoot, congenital heart diseases, and urinary tract malformations. The link that might exert reliable and productive control over morbidity, mortality, and disabling rates, as well as significantly optimize the cost and efficacy of treatment for those who had fallen ill and for persons at risk, is defining as personalized and precision medicine, or in brief, PPM. This strategy proposed would give a genuine opportunity to secure preventive, prophylactic, therapeutic, and rehabilitative measures whose individualization could have a significantly positive influence on demographics globally. Sorry. NIH, US, whilst being a strategic center for American and international for medical research and practice, has included PPM into a list of the 5 greatest priorities of development of biomedicine and healthcare services in the centuries, and have approved on setting up in the USA academical clinical research network entitled as Centers of Personalized and Precision Medicine. Several examples, please just look through. One of the best, Perelman Medical School in Philadelphia. In this sense, we would really need centers for personalized and precision pediatry and reproductive medicine. Designed to bring next generation care to children and their mothers by using advanced technologies to understand the child's unique genetic makeup and offer tailored treatment, and to be developing newer diagnostic, prognostic, and predictive tools, as well as newest therapeutics that target specific diseases, improve health, and to strengthen the reproductive resources. Again, several examples. Inglewood Center for Personalized Pediatry in New Jersey, US. Center for Personalized Pediatric Medicine and Surgery in Florida. Meanwhile, the aim of pediatric and reproductive PPM, for instance, I do believe, is to uniquely combine genetic variation with developmental stage and environmental exposure, so-called exposomic, to provide a tailored preventive, diagnostic, and therapeutic regime. PPM is thus a new and exciting field with the potential to significantly improve medical care for children and their relatives and young and smart communities. Meanwhile, the recently established at Columbia University Reproductive Precision Medical Center. Look, please. Atlanta, Perimeter for Personalized Reproductive Medicine. Family Planning Michelle Wagner Center in San Diego, fantastic place at Pacific Ocean. Family Planning Clinic at Medical Center in San Diego. Develops and evaluates new genomic tests, technologies, and treatments, and translate them in a stepwise manner into care services. In the near future, as the genes leading to the inborn defects are identified, medical and in utero gene therapies may become possible. Just look. The patients represent a wide cross-section of both normal and abnormal human pregnancies, sometimes from the pre-implantation embryo to the end of pregnancy, being based on the pre-implantation genetic diagnostic tests. Look at, please. The information from those technologies allows individualized counseling and care based on the latest high-tech innovations, including genetic mapping. Just very brief illustration of the latter. Genomic profiling via next-generation sequencing and transcriptome co-profiling in human oocytes and pre-early embryos reveals key human ZJ factors. Look, genomics of reproductive disorders in a very broad scope of view vision. And overall, genetic factors contribute to risk for many common diseases, including reproductive disorders. Meanwhile, a system of AVBMs provide information about a woman's potential fertility so she can make informed family planning choice. To identify ovulation and track this vital sign of the menstrual or female reproductive cycle, and educate the parents of the near future about reproductive health. Look, it's just very brief illustration disclosing or unlocking FABMS. Well, PPM is a goal of the modern and upgraded healthcare in which diagnostic and treatment decisions are informed by each person's unique clinical basics, so-called omics portfolio, and environmental, so-called exposomics related information. To achieve the implementation of PPM concept into the daily practice, it's necessary to create a new principle, a new strategy based upon and driven by biomarkers. That's a very explanation of the term, but it's not new for you. Meanwhile, to really understand PPM deeply, we would have to assess the armamentarium and tools to exploit and practice PPM resources and genomics tools, including genomic biomarkers in particular. In this sense, PPM and personalized precision genomics, as the crucial part of the latter, are a new and exciting field with the potential to significantly improve medical care for children and their potential parents, wheeling up the healthy family and wellness. In general, three major types of genomic biomarkers are crucially important and valuable for PPM-related services: diagnostic, predictive, and prognostic ones, to be used in most of genomic testing platforms to assess the genetic variations. Look, please, it's just the explanation and disclosing of the impact of diagnostic, prognostic, predictive biomarkers. Meanwhile, the effect of genetics often depends on developmental stage of a child and environmental exposure, such as infection or tobacco smoke, for an example, during a specific stage. And the aim of reproductive PPM is to uniquely combine genetic variation with the development stage and environmental exposure to provide a tailored preventive, diagnostic, and therapeutic regimens. Among different types of genetic testing, I would focus your attention on the principal and crucial one. Carrier testing is offered to individuals who have a family history of a genetic disorder and to people in certain ethnic groups with an increased risk of specific genetic conditions. Predictive and pre-symptomatic testing. The market for those is expected to grow due to factors such as the increasing prevalence of genetic disorders and increasing demand for genetic counseling. Preconception testing. Look, please, it's just very brief, disclosing the meaning and impact. Newborn testing, to identify genetic disorders that can be treated pretty early in life and other disorders including monogenic and orphan diseases. Prenatal testing, an IPT, to detect changes in a fetus genes or chromosomes prior birth to secure the biosafety. Nutrigenomics testing is a specialty of the interaction between genes and nutrients, whilst prompting to get the individualized diet based on precision foodomics set up. It suggests that an individual's diet should be matched to their genetic makeup. Look, please, it's just the illustration of personalized nutrition plan being based on individualized genetic makeup and precision foodomics. And finally, pharmacogenomics testing is aimed at tailoring drug therapy at a dosage that's most appropriate for an individual patient with the potential benefits of increasing the clinical efficacy and individualized safety. Pharmacogenetic testing identifies individual differences in how well or badly people respond to particular drugs. Look, it's just the illustration. Meanwhile, a combination of genomic and phenotypic biomarkers are becoming of greatest significance to be translated in the daily PPM-related pediatric and reproductive medicine practice to predict risks of the inborn, I would stress, predict risks of the inborn defects and us of disabling in the future. Fertility specialists already use specific genomic and phenomic biomarkers to help make the right preventive, prophylactic, or treatment decisions. In this sense, reproductive PPM is at the preliminary stage of discovering and validating genomic, proteomic, and metabolite biomarkers. Well, who will patients or pre-illness persons at risk, and for sure their physicians, trust to store and interpret the clinical data collected, harvested, mined, and interpreted? Healthcare IT. As a result, a patient or a pre-illness person at risk becomes a data carrier. Look, the average patient is a source of phenomenal bulk information profiled as 665 terabytes. The clinical research and translational applications into novel therapeutics will help enable children with previously debilitating and fatal genetic disorders. The causal gene is known for more than 3,500 monogenic and orphan diseases. It's just an example. Look, it's just the market. But for children who are still developing and have the most to gain, PPM is more than a bumper sticker. On the micro scale, pre-early, I mean subclinical genetic testing, perhaps routinely someday newborns can help guide medical care, targeted therapies, and preventive strategies based on a child's genetic makeup. On a macro scale, big data from the large population becomes a predictive tool guiding medical decisions that could be life-altering or modifying in a still animal child. PPM-related reproductive medicine has already accomplished a lot, but there is a strong road ahead to truly achieve PPM. There are difficulties in transforming the research results of genetics and biology into clinical application. PPM might be able to fill this gap between basic research and clinical application to drive reproductive medicine in the correct way. To solve that kind of problems, personalized aims and objectives exist at every stage of disease initiation and progression to develop a personalized health plan addressing lifestyle, risk modification, and disease management, and later personalized health management and wellness program. This approach mentioned should be based on postulates which will change the philosophy of family planning, incarnate culture, and even social mentality as a whole. So, just keep you on the way to understand that the grand change and challenge to secure our health and wellness are rooted not in medicine and not even in science. Just imagine where? In the upgraded high-tech culture. To secure the next step outcome in the therapeutic future, to secure prevention, prophylaxis, canonical treatment, and rehabilitation as the new entity. Great thanks you for your patience.
Thank you very much for presentation, and it has